you so much for being
Okay,
here.
to everyone that is in attendance mode, we are recording this discussion and it will be posted later on the Port Washington Library site and YouTube. So look out for it there. Project Help, the reason why we're doing this, we're bringing awareness and education to those who are suffering mental health and wellness issues, especially during COVID-19. And tonight's focus will be on the co-occurring substance use disorders, how it's affected seniors and children. All right. So what I'd like to do is to first thank the Port Washington Library, Keith Klang, Director, and Technician Jeff Zay for helping us out and doing this. Very generous of the two of you. I also want to thank the Peter and Jerry Family Foundation for their generous support and the support of the Kiwanis Club of Manhasset, Port Washington. All right. So without further ado, I'd like to bring out the professionals and go by their titles and names. We have Dr. Jeffrey Reynolds, who's President and CEO of the Family and Children Association, FCA. Dr. Joseph Smith, Clinical Psychologist and Addiction Counselor at Long Island Reach and Port Counseling. He's the Executive Director at Long Island Reach and Port Counseling, Port Washington, New York. Steve Chassman is the Executive Director of LICADD, Long Island Council of Alcohol and Drug Dependence. And Pastor Danillo Archbold, Senior Pastor, New Jerusalem Cathedral, Mental Health First Aid USA Instructor, Interfaith Council, Nassau County D.A.'s Office, Vice Chair, Nassau County Police, Commissioners Community Council, Interfaith Advisory Council, 7th District, New York State Senator Anna Kaplan. That's a mouthful. All right. Well, in any case, tonight, again, we're going to be going over what is going on during COVID-19, especially during these stressful times as well, the co-occurring substance use disorders and how it affects also seniors and children. I'm going to ask my co-host, Kathy, to kick it off with the first line of questions. And by the way, just jump in after the speaker finishes. If you'd like to add your own take to it, please do so. This isn't just one and done. We're going to have a little interactive discussion here. So.
Good evening, everybody. Thank you so much for joining and thank you for listening. It's great to have a panel like this, people who are experienced and wise and willing to give of themselves as you do. Thank you. One of the terms that we were talking about is co-occurring, and I thought maybe to kick this off is to get a definition. What is co-occurring? What is that definition for the guy on the street? Who's not a clinical psychologist, social worker, and so on. What does the term mean? And so maybe, Dr. Joe, I give that to you. What is co-occurring? What does that term mean?
Well, thanks, Kathy. First of all, I want to thank you and Jeff and the Port Washington Library for organizing this and giving us this opportunity to have this discussion. I think it's critically important that we do this and that we do it with as much opportunity to involve as many people as we can. These are critical issues. Co-occurring disorders is a term that's used in a number of ways, but essentially, I think the best way to think about it is two disorders, two problem areas that happen at the same time. So, someone who may be struggling with or have issues with drug or alcohol use, or chemical dependence, or addiction, but also with other mental health concerns. Could be depression or anxiety or personality disorders, mood disorders. And that's sort of been historically what the term has come to mean and how it's utilized. In my view, and I've always felt this way in my professional experience, I don't think that it's really possible to have chemical dependency disorder or problem or focus of attention without also having other issues that you might be struggling with. Let's keep in mind that the purpose of a drug any drug, which would include alcohol, is to deal with or to address in some way underlying pain. You take a drug because it makes you feel better, albeit for a short duration, albeit with all kinds of negative consequences, albeit perhaps ineffectually. But the purpose of it is to make you feel better. And most of the time it works, again, for a short period of time and with all kinds of complications and all kinds of implications. But it works. It provides relief from some kind of pain. That could be emotional pain, could be physical pain, could be spiritual pain, could be a sense of loneliness, a sense of despair, a sense of hopelessness. It could be depression, it could be anxiety, it could be any number of other symptoms. So to me, it really is something that is pretty widespread, that for the most part, people are struggling with drug or alcohol issues, are also struggling with other sources of pain and discomfort.
Would anyone else like to jump in there? Please
Look, I think Joe nailed it. He hit the nail on the head. We used to talk about what percentage of folks with substance use disorders also had mental health issues running simultaneously, and there were actually treatment facilities in our marketing that talked about how they treat co-occurring disorders. The reality is that Joe is right. Everyone that has a substance use disorder pretty much had a mental health issue running in the background. You know, when we think about the issues that have hit this region and the rest of the nation pretty hard over the past couple of years, think about opioids. What are opioids used for? They're used to treat pain, typically physical pain, but lots of folks realize they also work really well on psychological pain and spiritual pain. So when we think about alcohol and the use of alcohol and why people use alcohol, if you look at alcohol sales right now, they've gone up in a pretty significant way. If you trust the official data, it's at least 35% in terms of the sales. I would venture to guess if you ask the average person if their consumption had increased, they would tell you yes. And if you said why, they'd say, well, I'm anxious, I'm a little bit depressed, I'm not going to work anymore, the future is uncertain. And so we've seen, you know, an increase there in medicating away the anxiety, the depression, all the feelings that go along with the pandemic. We've seen that on full display. I will say for young people, in which young people are a little bit different, I know we're going to talk about kids today, you do see instances where kids experiment, right, once or twice with the use of drugs, and they will say, well, I was bored, or my friends did it. That's a slightly different thing. And the kids that I worry about most, and probably we all on the panel worry about the most, is the kid who says, well, I checked out, it was all right, and then I went back to doing what I was doing. There are children, whoever, will say, it's the first time in my life that I felt normal. It's the first time I felt like everything clicked. It's the first time I wasn't anxious, I wasn't depressed, I wasn't worried to death, and it worked really well.
I'd like to say something, Kathy. I think
sure.
Dr.
Yes,
Joe
please.
hit it on the head. I mean, he simplified it. Anyone that's not in the medical field could understand exactly where he was coming from, that it's two different disorders occurring at the same time, right? And as a pastor, a lot of times people don't talk about it, but you can't pray your way out of chemical imbalance in your brain. You can't pray away, as a pastor, someone who's addicted to either alcohol or substance abuse. We believe in a higher power, but the mere fact remains that there are chemical imbalances in someone's system. And so they need professionals like yourselves that we as clergy or mental health first aid responders can direct them where they can receive the appropriate help, right? And when you talk about young people, yeah, they experiment, right? And even if they don't have some type of mental health issue, the constant use or overuse of that drug or substance and or the combination of alcohol can lead to depression, anxiety, schizophrenia, and things of that sort. And so we need to take a look at it. You know, there was a study done back in 2014, 7.9 million adults in America, right, had some form of co-occurring or comorbid disorder going on. So it's really out there. You can imagine what's going on now with the isolation of the young people and even our seniors, right? That number must be astronomical now.
Go ahead, Steve.
The only thing I would add, and I agree with all my colleagues, is I'll play the other side of the coin that, listen, if you don't have anxiety going on right now, you're probably not processing emotions, but anxiety doesn't qualify you for a general anxiety disorder or a panic disorder. You can use substances and not meet the criteria for a substance use disorder. This region, and we've surpassed 110,000 Americans who have lost their lives to COVID, particularly older adults, and this region disproportionate. You know, there's healthy grief and loss and reactive depression or sadness. And then there's clinical depression where literally your activities of daily living are being impaired. You know, lost. There is criteria, a book that many of us in this field share that, you know, is it a reactive depression or is it clinical depression? Is it substance misuse or does it meet the criteria for a substance use disorder? So I think that's the only thing I would add is that, listen, there's anxiety and then there's a disorder with general anxiety disorder or panic disorder. I think most of us are dealing with levels of anxiety right now that could potentially cross over into a clinical diagnosis. But, you know, one of the things we should talk about tonight is how to manage anxiety. What are healthy wellness self-management practices? And even some of those have been interrupted with gyms being closed. And what is a diagnosable impairing diagnosis that reflects itself in the Diagnostic Statistical Manual of Mental Disorders put out by the American Psychiatric Association. But I agree with my colleagues.
Yeah. Just to let everyone know, these are statistics that are received from the Heroin Task Force in Nassau County. Year over year, from January to April, there was a 150% increase in non-fatal overdoses, and fatal overdoses, a 300% increase. You know, and that was during COVID, and that's very alarming. People are doing what they're doing, and as you said, Steve, there's got to be certain healthy coping skills to work on and to use. And for one thing is to end the stigma. All right, don't keep it to yourself. Reach out, very important. Reach out to your friends, your family, and so on. It's very important. So. Kathy, you have anything to add or?
No, go right ahead. Go right ahead.
Okay. I know you had mentioned, Stephen, something about prescribed medication compliance as opposed to self-medication.
Yeah.
Yeah. Could you elaborate on that?
Yeah, I mean, I think the first question and all the panelists weighed in on that, where, you know, for people with legitimate psychiatric conditions, and we won't say illnesses, because people can live with conditions and manage them. People who are bipolar, if they take their mood stabilizers and, you know, they're not introducing mind and mood altering drugs. Now, you know, when we counsel people with co-occurring disorders, we don't tell them, hey, don't do drugs because it's not good for you. We try to explain to them, listen, if you're on a mood stabilizer that's trying to balance your serotonin and dopamine, the minute you introduce a stimulant like cocaine or sometimes even caffeine, that can throw off that neurological balance that makes for depression or mania, as in the case of bipolar disorder. So also for people with general anxiety disorder, and listen, I live in the Huntington area, and I know a pharmacist in Huntington who writes more prescription for Xanax than anything else. Now, are we truly that anxious a country? I don't know. But, you know, most of the panelists know heroin withdrawal, you wish you were dead, but it won't kill you. Xanax, Klonopin, Valium, and Ativan withdrawal requires medically supervised detox, as well as alcohol. And Dr. Reynolds and Joe Smith spoke to, you know, alcohol sales. So people that were recreational drinkers maybe have crossed that boundary. So if you're prescribed a benzodiazepine, which by the way is the medication for anxiety, it is not the treatment for anxiety. The treatment for anxiety is with a professional or with a support network, addressing your fears and assigning coping mechanisms or solutions for that. For people who suffer from panic and whatnot, you know, they can't be taking Xanax like Skittles over time if it's not prescribed that way. Or, you know, if one Xanax isn't doing it, let me try two, or let me introduce some vodka. Then you're into self-medication. For people who are prescribed medication for some of the more impactful disorders like schizophrenia or bipolar or some of the quote unquote psychotic disorders, it's really imperative that you take your medication as prescribed over the regular time that it's prescribed. One of the biggest reasons that we've investigated, the data shows this, people with psychiatric disturbances stop taking their medication for the reason being they feel better. Did you ever think that you feel better because you're taking your meds? And that ties to self-esteem stuff. None of us like to wake up in the morning and look at a bottle of SSRIs or you know, antipsychotic medication and say, hey, I feel really good about taking this. But through education, through professional help, through support networks, having a greater understanding of your psychiatric disturbance, taking medication as prescribed, and of course, not introducing those self-medications in an attempt to maybe ground yourself, particularly when you're trying to balance some of those neurochemicals that organically can make for imbalances that are the root cause from a neurological standpoint of some of these psychiatric disturbances we're here to address.
Kathy, do you have anything to ask? I mean, I do as well, but.
Sure. No, sure I do. I was just looking there at Pastor Danillo, and you know, we are in unprecedented times since it seems like the world stopped back in February, and we all went into bunkers, and people weren't working, weren't going to school, all the things that we know to be our life, graduations, birthday parties, funerals, none of those were happening. And you, sir, I think are the man on the street where you see face to face, you know, within your church, people who are suffering. Can you speak to that, sir?
Yes, I can. One of the things that we started to do was reach out to the pastors. So I partnered with the Department of Mental Health and Hygiene in New York City underneath Mayor de Blasio. And I actually got a phone call just to speak to what Dr. Steve was talking about support groups. So I got a call from the commissioner of that department, and he began to share with me that in the last 48 hours alone in New York City, that there were a team of mental health clinicians and doctors coming together to talk about taking mental health first aid training to the next level. So no more are they talking about teaching people the dynamics of mental health first aid training and pinpointing and assessing and pinpointing what's going on with the individuals, but forming these support groups, right? And peer support groups that can help the individuals talk about the anxiety, the depression that they're going through because of the isolation that they're going through and experiencing right now. Whether it's the child, right? Children need structure, right? Now they don't have that structure of getting up in the morning, going to school. I had the situation with my 17-year-old, right? That didn't want to get acclimated to the Zoom. Right? But after a while, after trial and error, and going through the motions again, he got acclimated to it and he did wonderful with it. These are the types of things that we see. How do we deal with the grief on grief when someone has lost a loved one, right? Due to COVID. They not only are they in a hospital now, they're isolated. What mechanisms or things can we do now to go beyond that, right? So we read books, we exercise to try to do what? Have a peace of mind, right? Because we're isolated in the home. Take short walks, of course, practicing safe distancing, wearing our masks, right? Texting one another during Zoom. It relieves the anxiety, the stress, right? The lack of contact. As human beings, we are created for that, hugging and touching one another. And so these are the ways in which we deal with it, right? Especially with our young people and our elderly. We pray. Of course, we pray. We pray. We have to. We have to reach that higher level, to that higher power that we believe in, to help decrease that stress and that anxiety in our lives personally. And then we teach that to our congregants as well.
Thank you. Thank you. Go ahead, Jeff.
Okay, before I start with the next question, which is going to be a twofold question for Jeff Reynolds. Today is the day, 1 year today, Jeff, that you spoke at the Port Washington Library about co-occurring substance use disorders. It's amazing. It was big then, it's big now, and hopefully it won't be that big down the road. But I also want to welcome the officers and members of Kiwanis, New York State. I know we have the current New York District Kiwanis Governor, Joseph Ruggiero, and his project this year is about mental illness, wellness, because of his mom and what she was doing in the field to help folks. It's been a great project, and the Circle K division of New York State Kiwanis doing the same thing. That's the college level Kiwanis. So I, as Lieutenant Governor last year, decided that project Help Long Island was going to bring mental health and wellness to the forefront. And so far we've been doing that with the generosity of the speakers' times and expertise. And hopefully we're making a difference out there. And that's the whole point here is we all have a hand at this. We're all the human family. So, you know, again, so what I want to ask Jeff now, Reynolds, is a twofold question, and anybody can jump in, you know, afterwards. Now that school has been out, all right, we have another 6 weeks worth of summer. Sometimes teachers, coaches, social workers pick up things happening with kids and turn to parents to alert them what's going on. So without this extra set of eyes, how can parents remain vigilant without being overbearing? And how come seniors seem to be at high risk, or is it more than just, I guess, well, we'll go to that. But how can parents remain vigilant without being overbearing? How can they take care of their kids, especially now?
So Jeff, thanks for the question, and thanks to you and Kathy and the rest of Kiwanis. You guys have just done a phenomenal job at spreading the word and hosting events like this, and all of us in the community certainly appreciate it. You know, the reality is this is the type of stuff that reaches folks and engages them in care and support, and helps to destigmatize, which I know is a big goal of yours. So the issue of schools is a significant one. And I think parents are now learning the incredible role that teachers and guidance counselors and the entire school structure plays in the lives of kids. You know, as parents struggle with Common Core and struggle to get their kids up and stay in a routine, at the same time doing their jobs. I think, you know, this has really brought to bear and maybe hit the reset button in terms of the way we value our teachers, the way we value schoolwork. I think parents would say it's brought, you know, us and our kids a little bit closer to be doing this. But I think a lot of parents would also say, boy, it's a lot of work. And, you know, at FCA, we have 340 employees. More than 78% of them are women. A good percentage single moms. And I'll tell you, more than one staff person has said to me, you know, I've got kids tugging at me, asking for time, and I'm on a Zoom meeting for my job. And this is really a struggle, I think, for a lot of parents, and highlights our deficiencies in terms of childcare and the support we have out there for families. And to your question, I would say to parents, and I've said this before publicly, probably at the forum we did a year ago, it's okay to be overbearing sometimes. That some of the things that we're talking about when it comes to our kids are life and death questions. I think the main struggle right now is finding that balance, and increasingly schools are saying, all right, look, we move to pass fail. You know, creating that family time and maintaining your mental health is more important than grades any day of the week. But keeping some structure for those kids, ensuring that you don't suffer significant learning loss over the course of the summer, and positioning them to return to school hopefully in September is a really important goal going forward. And so a couple things that I would say. When we think about stress and anxiety and depression that might lead to substance use, you know, we look for telltale signs. Is your kid sleeping more than they were before? have the relationships changed in a significant way, either with you as the parent, and I'm not talking about transitional everyday stuff, or with their friends or with their siblings? Are you seeing a decline in physical hygiene, for example? Now, some of this stuff is admittedly very difficult in this day and age, says a guy who, just shaved yesterday for the first time in 3 days, right? And so some of this is situational, but you look for clues like that. We've always said if kids have a major shift in their interests, in their financial status, in their sleep patterns, in their eating habits, in the way they take care of themselves, in the way they interact with all of us, those are signs that perhaps something's going on. I would say, and to Steve's point a little bit earlier, if there aren't some changes happening in this environment, you have to wonder why too, because we've all adapted to this environment. We've all changed the way we're doing things. But this is really an opportunity. And so we can look at it in that, we're trapped in the house with our kids, or we can look at it in that we now have a new window into things they might be experiencing during their developmental milestones, that if we're out there working 12 and 16-hour days in our offices, we might not ever see. And so look at this really as a blessing. It's time together, and I know it's sometimes hard. As someone who has taught my young son to stop doing the grouping and just carry their one anyway, it's not always easy, but this is really a gift and a blessing. Most parents have never experienced the opportunity, especially for men that typically go outside the home or women who do, to spend this much quality time with our kids looking at their schoolwork. I've learned things about the Revolutionary War that I didn't know before because I spent my high school years doing something else. And so, look at it as a blessing. And I would say, look at it with a critical eye and kind of think through where we are and think through where you want them to be. And so some of this is just paying attention and sharing the meal together and taking the walk at 12 noon that you could never take before. And so, I think the main message out of this is, keep an eye on them, worry about them. We always do. I don't have to tell you to do that. But most importantly, just spend the time together, because in a lot of ways, it's a gift.
Go ahead.
Steve?
Oh, just to follow up on Dr. Reynolds, I mean, right there is the point, but not to compound the problem. But if we are going to take an objective view of things that we could potentially improve, I think Dr. Reynolds and Dr. Smith and Kathy, if a child needs a psychiatrist, I mean, what's the wait to see an adolescent or pediatric psychiatrist? I think we're all dealing with some financial insecurity, a lot of which is tied towards health insurance. Do health insurance, listen, again, to the self-medication. If you need to see a psychiatrist because you're depressed, you can see a psychiatrist in 3 months, and it'll cost you $500 for the consult. And if you need medication without health insurance or you're underinsured, that could be another $300. Who has $800 just lying around, and that doesn't even include counseling? So when we talk about insurance, is it a right or a privilege? And that's not a political statement. That's just people need help. And they're just not being allotted enough of it. And I think for those of us who work with adolescents, there are some people that really need to get to a psychiatrist to get pharmaceutical support, therapeutic support, or to access some of the programs that some of my colleagues run, reputable programs here on Long Island, that because either they have no insurance or underinsured, it puts tremendous strain on the individual and the family, not just because of the behavioral issues associated with a lot of pediatric and adolescent psychiatric disturbances, but financial stress on the family.
So I'd like to just add a somewhat different perspective, or maybe it's not a different perspective, but an additional perspective really, which is that pandemic aside, we have not invested as a society in the kind of services, the kind of resources that need to be available for people who need help. And that's the sad reality. And it's about insurance and healthcare in that sense. It's also about where we set our priorities as a society. One of the things we know about kids and experimentation with drugs that graduates, when it does graduate to more severe use and when it becomes a serious problem, is that what often it is there, the reason that it happens is because other systems have failed, because we have not provided for kids the kind of opportunities that offer them hope a sense of opportunity, a sense of accomplishment, an opportunity to have fun in a creative and meaningful way, in a constructive way. And as a society, we don't value those things the way that we need to. We concentrate a lot on academic achievement. And for many kids, that works just beautifully, but not for everyone. We treat our children as if they are discretionary. And I use that term intentionally because in our state and in our county, and probably throughout this nation, for the most part, services for young people and services for seniors as well is considered discretionary. And so when there are budget problems, and God knows we're going to be facing tremendous budget problems in the state of New York as we go forward beyond this pandemic. When we have budget problems, the first thing that gets cut year after year after year are services for kids and services for seniors. And then we wonder, why do we have a problem with our young people? Why is it that young people turn to drugs? There's been research that's been done that demonstrates that when people, not just kids, but when people have meaningful opportunities for pleasure, for achievement, for satisfaction, for gratification, drug usage declines. As those opportunities are limited or restricted or constrained in some way, drug usage increases. And there's no surprise there. It's basically common sense. Drugs treat discomfort, pain, a sense of meaninglessness, hopelessness, despair. And if we don't offer alternatives to that are constructive, well, the dealers on the street will fill the void. And so we know that if we don't treat the underlying symptoms, depression, anxiety, we know that suicide rates will increase. So when we look at some of those statistics that you mentioned earlier, Jeff, about the increase in opioid deaths, and some of that, I think we have to look at and we have to say, there's no surprise there.
And just to pick up on Joe's point, I mean, really what we're talking about is the value of prevention, right? We know that if you intervene early, that if you do the prevention work and you make the investment, whether we're talking about kind of modeling, behavior in your own home or public investments in prevention, treatment, and recovery, we know that it pays off, several times over. One of the things I worry about, and I think we spoke about this last time, is that we come out of COVID having treated the virus and the immediate exposure and the immediate medical concerns, and then we pack it all up and we call it a day and we go back to shopping and everything else that we were doing before, without recognizing that there are folks that are going to have a very lasting impact to all of this. The economic impact of COVID has been very, very significant. We haven't seen unemployment rates like this in 100 years. That's going to have an impact on families that are trying their darndest to survive. That's going to have an impact on those kids. And think about the incredible amount of stress as families are missing rent payment after rent payment after rent payment. We know that some communities on Long Island were hit harder than others. And I'm speaking mostly geographically as well as demographically now. And that you look at Brentwood, which had more cases than 28 American states. You look at Hempstead that has 11 times the number of cases than Garden City does a mile up the block. And we know that those families suffered losses. We know they suffered trauma in a way that's disproportionate. And we know that there are folks, as we talk about reentry, who are going to try to get back to work that first day, assuming they have a job, and they're going to try to walk into that office and they're going to decide it's too much, or they're going to get in the car and say, you know what, I can't do this. Or 2 o'clock is going to roll around, and that's the time when they usually had a drink to take care of the anxiety, and you can't do that in an office. And so we know that there's a trailing effect to this, but government doesn't look at things that way. Government, whether it's Nassau County or New York State, the immediate problem solved, we're back to the beaches, haircutters are open, and we're declaring victory and talking about crushing the curve. Well, let me tell you, the curve is still on the upswing for a lot of folks out there, and unless we make those investments now, it's not going to happen. And quite frankly, legislators respond to public input and outcry. And so if all of us that are part of this meeting tonight believe in the value of prevention and treating these conditions early and making sure people have access to services, you know, think about weighing in with your elected officials and say, I know Nassau County's been through a tough time, but please prioritize these services. And the same goes for the state and federal governments as well.
Listen, I'm glad that Dr. Reynolds and Dr. Joe spoke about what is it that we really value. This is a humanitarian issue here for me as a faith leader, as someone who works closely with legislators, and a host of elected officials. And we all know that COVID has hit the Black and brown communities disproportionately, right? And so we see a whole bunch of other things, underlying issues that have been exposed. And so when you look at the Black and brown communities, where are the resources to help them going through the trauma, the stigma, right? They don't want to come out. To be honest with you, Black people and Hispanic people are less likely to come out. There's no medical insurance access to affordable health care, all right, to get the medication that my friend Steve is talking about, right? You know, where are the country's priorities at? When you talk about lack of education on how to deal with the stresses and the anxieties in the homes, a lack of food insecurities, all of these issues here compound mental health issues. And unless we talk to our elected officials and put the pressure on them at the voting polls, guess what? Nothing is going to change at all. Nothing is going to change.
And as you look at school budgets, and there's going to be a lot of challenges, but we would have said this 2 years ago in some communities, in a very fast-paced world, what is the first thing to go, particularly in underserved communities, when budgets have to be cut in school districts? Athletic programs, music programs, art programs. These are all programs for self-expression. And it's really, and great reducers of stress exercise. And it is strange where I remember, you know, Wine Dance community, great community, LICADD does a lot of work with that. You know, they had to cut some athletic programs. You know, Half Hollow Hills is 2 miles down the road. And, you know, this is obviously a broad topic, but if there's going to be recovery, there needs to be recovery across the board. And I think America is going to have some really hard choices when it relates to healthcare, when it relates to education. And as Dr. Reynolds and everyone else said, our elected officials are going to have to make some really hard choices in the next couple of months about what stays in and what stays out. And, you know, the pandemic of the mental health or co-occurring disorder crisis, we could very well be not in the 9th inning, we're in the first inning, first pitch, where, you know, the unemployment rate at 20%, people dealing with levels of anxiety, alcohol sales up, you know, that imaginary line into substance misuse to abuse and dependence is being crossed. We've seen it across Long Island and clear across the country. So, you know, to Dr. Reynolds and Dr. Smith's point, and of course, my friend, the pastor, you know, it's a time to speak out because the mental health crisis just may be ramping up, unfortunately.
One of the things I'd like to add that we've done to Dr. Joe's point is that we've created, my wife and I, so we've partnered with STEM organizations and the SUNY collegiate system by offering communities of colors and their young people opportunities as a gang and drug deterrent, all right? For them not to be involved in gangs, not for them to use drugs. So getting them more involved in STEM education with science, technologies, robotics, codings, things of that nature, where they get to go to these programs free due to large donations by corporations and even the SUNY system to help them acclimate themselves to that and use it as a deterrent, right? For stress, anxiety, and drug abuse. These are some of the things that we've been doing already.
Somebody mentioned the issue of seniors, and you know, I don't want to overlook that, because I think when we talk about disparities, there are long racial and socioeconomic lines without a shadow of a doubt. And now it's on full display. And when it comes to seniors, we've seen those disparities as well. You know, we have, 5 different senior programs that we operate. We serve about 20,000 Nassau County seniors a year with a mental health program and case management. We also have a state-sanctioned volunteer in every skilled nursing facility across Nassau County. up until the time the pandemic hit. And I will say that the wreckage in those facilities, the devastation among seniors and their families has been epic. You don't necessarily hear about it as much because they're suffering very quietly and silently, but the amount of fatalities and the inability on the part of families to celebrate that person's life or to be with them at the end is game-changing and life-changing. And now you have a lot of seniors that are afraid to go out, who quite frankly, given their health profiles and the risk profiles, probably shouldn't be going out, who are dealing with depression, who are watching their friends die, who are struggling to configure FaceTime to spend 5 minutes with their grandkids, you know, and who have sunk into a very, very deep depression. And we know that alcohol and other drugs impact seniors in a way that's different than those who might be older based on metabolism and body weight and everything else like that. And these are folks that are right now shut in their homes. They're not out overdosing in public. They're not stealing money out of cars in order to finance their habits, but they're quietly struggling. And we've got an entire generation of seniors that's having a really, really hard time without a very, very loud voice. And so I worry about that. And I hope that as we come out of this and we talk about lessons learned, we've got to do something different with the way we manage seniors. You know, to Joe's point, it seems like we never prioritize kids or seniors. We forget about folks at the beginning of life and at the end of life. And, you know, quite frankly, it's tragic. And so if you lined up kind of the net impact of this, of COVID-19, clearly the impact on seniors and their families has been very, very significant.
Yeah.
I'm going to jump to this one question in chat, only because it's based on what you were just saying, Dr. Reynolds. It's this comes from, let's see, how do we get over what happened to loved ones who are trapped in nursing homes with COVID-19 patients that the New York State governor ordered, and we could not visit them as well? So how has that affected the families?
It's, you know, as your question implies, it's been absolutely devastating to families to watch this happen. And you see images on the news of, you know, families standing outside windows at nursing homes and, you know, saying goodbye via iPads. And, you know, it's not to diminish healthcare workers who are willing to be by people's sides, although we should talk about their traumatic needs going forward, you know, but they've stepped up and done this, but it's not the same. You spend your entire life with a parent who brought you into this world, and your physical inability to be with them at the end as they leave this dimension is something that I think, you know, I don't know that it's something that you get over. I think it's something that you work through and you talk through and that you process, but I don't know that it's something that you ever get over. What I would say, and probably everybody on the panel would agree, especially the pastor, is, you know, there's a process for working through some of these things.
Yeah.
And because,
Before we move on, and I apologize, before we move on, Kathy and speakers, I had a request, and I will allow this only because it's the New York State Governor Kiwanis Joseph Ruggiero, who would like to say something. He's requested to speak on this as it's very near and dear to him. So Fort Washington Library, if we can do that.
Thank you, Jeff. Thank you. Good evening, everybody. I want to say, give out a big thank you to Kathy and to Jeff for hosting this terrific event. Very important. I want to thank the whole panel for spending the evening here, again, on this very important subject. When I was running for governor each year, I don't know if you're familiar with it, each year the governor approaching their year decides on something that's near and dear to them, as Jeff said. So I chose this this point to focus on for my year, and I'm so happy I did, because who knew this would happen, and how this is impacting so many of us, and being stuck at home, and with all the sickness and all, and the change that we're affected by, and so it's impacting us. So I just want to thank everybody. I have another meeting to go to a few minutes ago. I'm a little late, but so happy I stayed. And again, thank you all for spending this time and devoting yourselves. And hopefully we could, do more. And it's so important that we're bringing this out to the public and to the forefront. Just the fact that we're talking about it so much more, I think, is so helpful to so many people. So thank you again. I got to run. Everybody be well, be safe, and see you soon.
Thank you, Governor Joe.
Thank you. Thank you. Be well.
Thank you. You too.
Okay, Kathy, do you have a question?
Well, you know, there's so many things that are going through my head. I'm thinking about children and thinking about stigma. You know, when we see the way in which all of our lives have been turned upside down, things really are not the same. And as Dr. Joe and Dr. Jeff was saying about, you know, and Steve, services that are not coming and probably aren't coming because budgets will be made and people will be left out. And for some people left out again. And that's a tragedy. What do you have to say about, you know, the power of taking a positive look here, the power of community? Maybe that's where we all get to survive this, is to turn to our communities and dig into the resources of people, of human beings within our communities to get us through these difficult times. Maybe Pastor Danillo, you've got something in mind there because it's about the people, it's about the community, it's about reaching out to one another. And we may not be able to get it through services, but we can get it from our friends, perhaps, or our loved ones. Can you speak to that?
Yes, thank you, Kathy. And so funny that you said that because over the last couple of weeks, you talk about community. Over the last couple of weeks, you see the American public, Black, white, Hispanic, Asians, Muslims coming together to join hand in hand, hip to hip, because of the tragic death and how this young man, George Floyd, died. That's community. That's what it's going to take for all of us to get through COVID. That's what it's going to take for us to get through the stigma surrounding mental health pertaining to our young people. They're the future. If we don't do what we need to do now, Dr. Reynolds said it, we have to go to our elected officials. We got to impress upon them. This is what we want to see. You understand? If we don't decide to make the change and lead the way, our children are watching us in isolation. Dr. Reynolds picked up on it. They're watching us. They don't say much, they're watching us. How can I be a pastor, and I say this to people all the time, and I'm driving around drinking and driving and smoking weed? What kind of example am I showing? Setting, right? When I'm not showing people loving kindness like the scriptures talk about. In spite of what I see, in spite of what I say, I'm not preaching a sermon. I'm just giving you analogies, right? You know, Jesus said, when I was hungry, you didn't feed me. We need to feed hungry people. When people are going through anxiety and depression, we need to be able to touch them. They need a hug. They need a shoulder to lean on. They need someone that they can confide in, like the wonderful panel here, that they can sit down and talk to and get advice, whether it's medication, whether it's not medication. Maybe it's someone that they need counseling, right? So these are the directions that we need to go in. This is what we need to do. Earlier we spoke about, well, the touching, being the parents, the older folks, the seniors being in isolation. I've had so many friends. The lady in my community, dry cleaner, Italian lady, she's crying. I walk into the dry cleaners. This was 3 weeks ago. Oh, Pastor, you know, I said, what are you crying for, Miss D? She said, my daddy's in the hospital. We can't see him. We can't touch him. I said, don't worry. Do you have faith? Do you believe? You can't let what you see, what you hear affect what it is that you desire. That desire, that urgency to move you ahead is what's going to keep you going. So we have to have that inner drive, right? That comes through that talking and assuring one another, right? That edification, that support system. Our kids, when they fall, when they're riding a bike, we teach them these things. Get up. You can do it again. We brush the little dirt off of them, right? And we get them back on the bike and we train them. We have to come together as a community now, right? Through COVID, through what we're seeing, through the isolation, so that we can be a support to one another, so that we can live, love, laugh, and learn together, so that we can all flourish as a community.
So
Sounds great.
I think that there are, hopeful signs. And I think that, you always hope that out of some tragedy or some horrific event that some good might come from it somehow. In strange ways, that sometimes does happen. And so I too echo what you're saying, Pastor, in terms of that sign of hope that we have hundreds of thousands of people around this country in every state protesting, standing up and saying, enough is enough. Something's got to change. And it's, one of the things that I found most hopeful and most impressive was as I was watching, which I try not to watch too much because it can get overwhelming, but, watching on CNN the coverage of some of the protests in New York City and throughout this country and seeing the faces, right? And these were primarily Caucasians. There were people of all different backgrounds, all different races and all different ethnicities. But it was impressive to me that this was not only a response of the African American community. This is something that, and the other thing that was impressive about it was that it was a tremendous number of young people. And so it sparked a lot of hope, I think, and I think that building on that, change can come. Now, one of the things that's already happening, which I thought was rather interesting, is that in New York City, there is the movement now to move some of the money that is going to the police department and move some of that to provide youth services, which we talked about how that's generally on the chopping block. Mm-hmm. But here we're talking about increasing resources for young people. And we talked about an increase in services in the mental health area. Again, one of the areas that has been sorely lacking in governmental support in recent years. So I think that there are some hopeful signs. The reality is, and I've talked about this many, many times, and those of you who've heard it, you've probably heard it too many times, but the reality is that we spend in this country billions and billions of dollars on law enforcement, and it fails. We say we have a so-called war on drugs, and we devote countless resources to lock people up instead of providing treatment. We know that for every dollar we spend on treatment, $7 is saved in other social costs. And yet we continue to invest in locking people up, in punishment instead of health. So I'm hopeful that there's a movement afoot and that there will be some traction to this, because so many of the problems we've talked about came before COVID and will be here long after COVID. The reality is we talk about the nursing home situation. The nursing homes have been abysmally ignored. The two places that have had the highest incidence of COVID fatalities are prisons and nursing homes. Interesting juxtaposition, isn't it? Mm-hmm. Right?
Steve?
We haven't invested in our health care for seniors. Instead, we institutionalize and warehouse them.
Yeah.
That needs to change. We do similarly in our treatment of kids. If they don't make it the way that we think they should, academically successful, going off to college and graduate school and playing that out, what do we do? What do we do for them? We ignore them. And ultimately, we lock them up. Wow. We have our population of minorities. The population of minorities that are basically on track to end up dead or in prison. That needs to change. So the hopeful sign is that there are movements that are afoot, that are now waking up and saying, enough is enough. We have to do this differently. We have to make change. I think we all have to support that effort. We have to find ways to impress upon our elected officials that the way things have been isn't working. And the fact that COVID happened may be the impetus that allows for some change, some lasting change to take place. I would hope anyway.
Thank you. Stephen, you had something to say?
Yeah, just, and thank you for that. But, to community, there's a lot of psychiatric disturbances, including substance use disorder, where self-seeking, self-delusion, self-consumption makes for the illness itself. And I think America has a lot of that disease of I, me, and my, where, listen, I'm old enough to remember when the internet came about, and we saw a lot of changes in Europe and, Arab Springs. And it's, for a lot of us, it's been reduced to pictures on social media and internet shopping, not to mention unhealthy behaviors. There's something to be said about we. And, LICADD's been doing a lot of compassion fatigue, and you build self-esteem by doing esteemable acts. And to the pastor's point, whether you do the Jesus, Abraham, Buddha, or Muhammad thing, or the Mother Teresa or Dr. King thing, it's all about the ability to think beyond myself and to have a genuine concern for others. And I think, and listen, I speak to you in June, which in some self-help circles is called Founders Day. The 12-Step Fellowship was founded 85 years ago this month. The first word of the first step is we. I also need to point out, historically, the first word of the preamble of the Constitution is we the people. So there needs to be a collective conscience that is conscious of all people, not just the I, me, and my or our immediate family, but a great philosopher once said, you can't be a society unless, you're as strong as your weakest link. And the truth is that there are people on the top and there are people on the bottom. And if we can raise the bottom, we raise ourselves as a community. And, there's an old anecdote in psychoanalysis that says, for a guy who's depressed, I'm all I think about, And sometimes we need to get out of ourselves, and doing community service, seeing the energy in the street, and the pastor and I have talked about it over the last couple of weeks, getting young people involved in being invested in the lives of others, build self-esteem. You can sit and tell your child or a student how great they are. That's not self-esteem. They have to have a sense of worth. And to Joe's point, and Dr. Reynolds, everyone on the panel, we have to be invested in the lives of others. And for those of us who have been in healthcare and, long enough to remember another viral pandemic, I started my career in HIV and AIDS. To quote another literary quote, it was the best of times, it was the worst of times. We were losing a lot of people to HIV and AIDS in downtown New York City in the 80s and 90s. But you know what? I look back, and there were a lot of men and women who were really invested in trying to make that situation better. And I look to Jeff Reynolds, who is a great advocate, remains on, task force for HIV and AIDS. And that situation got better. It's not resolved, but we need to come together as a community and build a safety net so that we don't get lost in the I, me, and my. Anxiety and fear, it's our fears. It has to do with us. Sometimes, there's an old social work anecdote that says, the only time you should be looking down is when you're giving a man or a woman a hand up. And that helps. So, I think we could do a lot more as a community utilizing the we. There are certain clinical models that involve socialization, the whole peer movement, the whole recovery coach movement. You come in sick, you get well, and you go out and you help others. And not only do you build your own self-worth and self-esteem, you get a career out of it. Sometimes we got to lose ourselves to find ourselves. Wow, a lot of quotes today, sorry.
So Steve mapped out, I think, some solutions as we move forward, because I think the great question for a lot of us is, we've learned a lot around COVID. We've learned in some ways that the health of one community potentially impacts the health of another community. And I always think people should be involved in health issues for people who don't look, act, and talk like them because they care and because it's the right thing to do. But if we have to play on the self-interest to say, if you get sick, I potentially get sick, and so on and so on, then we should do that. But the question is, how do we sustain the effort? And as I watch what's happening in Merrick, in Smithtown, and communities across the nation, you know, how do we sustain this? Because the odds are we're not going to always be marching. That by this time next week, a lot of those marches will have petered out. Our memory and our concerns about COVID will have petered out. You already see people dropping the mask and that kind of thing. I guess the question is, how do we build that sustainability going forward? I believe, like everybody else has articulated, that, you know, COVID-19 was our reset button, whether we're talking about our own families or the environment and pollution or the way we view healthcare or the way we relate to each other. We got the reset button, and finding a way to maintain our concern for each other is really important. And I think, you know, pandemics or big monumental happenings bring out the best in people and the worst in people. And I think in this case, we saw by and large the best in people. Did you have your one-offs? Yeah, sure, you had that. But there was a point in time where people really worked together, where you drop soap and toilet paper off to your neighbor, where maybe you went to a food drive for the first time in God knows how long. And there's a number of folks who I ran into at a food drive in Hempstead, and one of the things we talked about, and there was, you know, 400 cars lined up, and we did this kind of one-time food drive, and it's been repeated a couple of times since then. But these are folks who are hungry every day and are going to be hungry every day going forward. And the fact that we had a food drive and a bunch of us put on masks and back up a truck and distributed pantry bags is great. But those needs don't go away because we all took our masks off and because life went back to what it was. And if we forget about those who, whether they're being choked out in the street by a cop or whether they're starving in their own apartments in Hempstead and Wyandanch and Brentwood, we can't forget that, right? And we've got to find a way to turn our immediate attention into long-term planning and long-term advocacy. The disproportionate, you know, spending on solutions that don't work, like cops and jails and things like that. And, you know, by the way, I hate the slogan, defund the police, right? Because now you have everybody running around saying, all right, then no one's gonna answer the phone when you call 911. That's not what people mean, but if you have to spend 1,000 words explaining a slogan, then something's wrong with it. But there is a legitimate conversation, and Joe and I have been around long enough, and probably everybody else, quite frankly, you know, to have lived through 25 years ago when we started saying, so what are we doing? We've created a paramilitary organization to deal with a public health problem. This makes no sense, right? And so punishing your way out of a health crisis and addiction doesn't get you where you need to be. Finding now the rest of the world and the rest of the country, including the young people who we've been trying to engage for so long, are saying this. Right? And not all of them have seen the history, but they know reflexively that building up police departments while social workers are holding bake sales in order to finance their clinics is a fool's errand. It doesn't get us to where we want to be. So I guess the question really is, so how do we sustain this? How do we continue to engage people? How do we keep the energy up? How do we score those incremental wins along the way? And just because I don't want to forget to say it before the end, look, showing up at the protests is really important. Showing up at food drives is really important. Showing up at the ballot box in November is probably just as important.
Yeah. I'd like to add to what Dr. Reynolds and all the other panelists said. It's going to take for us to keep showing up to vote locally, to change legislation locally. Yesterday, my wife and I had the honor of hosting a community meeting with elected officials, faith leaders, healthcare providers throughout Nassau counties. And I'm talking about at the state level. These are the guys who really look at what's going on and see where the funding. And to your point, there needs to be a reallocation of funds where you start providing funds to the healthcare providers, to the educational system, to the mental health people who can help the young people and help the families who are in disarray right now because of what's going on. If we don't look at it from that standpoint, and my brother Steve said, reaching back and picking somebody up, right? Accepting people because they talk different, they look different. I don't come from Jupiter, you don't come from Mars, right? My job as a pastor is to advocate, meaning I'm a shepherd. I take people from where they're at to where God needs them to be. That all I am is a vehicle. The rest is up to God to make the transformative change, right? But it's my moral compass, right? And Steve said it earlier, where's your moral and character? Where's your integrity? Where is that on an individual basis? So that when we come collectively, right, we see the differences, the shades, the skin tone, right? The accents, right? But you're still my brother and my sister, and I have to care for you in spite of what I see, in spite of, it starts here, up here. It starts here, right? And then it goes to the heart. The mind is the battlefield. It is what it is, right? And so we come together collectively as a community, knowing that I'm gonna take care of you. Because guess what? If I'm sick over here, guess what? When I go outside, I start to spread whatever it is I'm sick with once I go out and I engage with you. So I need to take care. It's all about self-actualization, internalizing, right? And then trying to, once I remedy myself and get myself together, going to my brothers and my sisters and bringing us all together. And we spoke about that yesterday, right? So we're forming subcommittees with professionals just like yourselves in the education field, law enforcement field, the elected official fields, right? And we're moving forward to try to make sure that Long Islanders, all Nassau and Suffolk, there were elected official law enforcement from both Nassau and Suffolk at this one particular meeting. And it was actually a closed door meeting that my wife and I helped put together. It was my vision, Dr. Reynolds, to do that. And it was, I mean, it was all shades and colors there. We got to make a change. It's about us. We cannot, you can keep crying, but if you're not taking care of home, right? Like, I got to clean my own yard before I start going to Dr. Steve's or Dr. Reynolds' yard and start cleaning. I got to pick the weeds out of my own
Oh,
yard.
no, come on over anytime. You're more than welcome.
I mean, but that's basically it. We have to take care of self, peel back the layers, look at what's wrong with me, right? Whatever my biases are, right? Then deal with that, get help for it, right? Even I as a pastor, I have someone I can go and talk to. Believe it or not, I just don't talk to Jesus. I got a therapist that I go and see. It is what it is, right? And so we need to help one another. We need to inform people. And I love you all. That's all I have to say.
Thank you very much. Thank you. If I could just say, it's not a question. I've just been listening to all of you and how articulate you are and how passionate and wise. I'm so glad that you're all on the program with us tonight. You know, as we know, this is a spring like no other. And maybe it's time for a good spring cleaning. But I worry that as a people, we have ADD, that we have a generalized ADD, and that we're all watching and following. And then when restrictions are lifted, we'll all run and into our little honeycombs and forget all the very things. So Steve, you were saying, you know, quotes tonight, but there's one quote for me as I'm listening and listening to all of you, by Maya Angelou. And it's simple, and it's, when you know better, you do better. And I really hope, it's just really making a statement that I really hope that people can understand that when you know better, you can do better. So just had to say that.
Amen. Amen.
Okay. One thing I just wanted to share is, you know, with everything that's happened, it's brought us to a new tech world, utilizing FaceTime, Zoom, Google Teams, whatever it is. Now we're able to connect to a larger audience. I know friends that are reaching out to people across the world on certain groups that they belong to. My mother was telling me she's going to go to a church meeting. I'm saying, you're not going to sit with a bunch of folks, are you? She says, oh no, I'm going to go on Zoom. I go, what? On my phone, you know, and this is what people are doing. And the kids can help out. And, you know, I hear more stories of connections between the older folks, their daughters, their sons, their grandkids, and they're making a way to connect and stay connected. People are reaching out to seniors in their community. I know Kathy and I, we belong to a senior community on the board, and it's tough. It's been closed for some time, and these people are suffering. They're isolating, and, you know, again, it's very difficult. So, you know, a phone call would be great. You know, delivering something would be great. You know, everybody has a part in this. What part do you want to play? As Jeff was saying, you want to just march in parades? You want to hold up a sign? Says, no, you got to get involved. You got to roll up your sleeves. It's as simple as that. Kathy and I, we chose different organizations to belong to. We believe in service, and it does keep you younger and keeps you better looking. I don't know.
That's why I nominated you for push-ups.
Yes, I know.
Or
And you're trying to
push-ups.
kill me, I know. So in any case, I just wanted to throw that in there. I mean, it's a whole new era now. But the thing is that what happens when all this is done? We just go back to usual? No, you know, no, it's not. Everything's changed. We have to address everything. We have to pick up the pieces and put them together, have it make sense. Simple as that. So
Jeff, don't get me wrong. There's nothing wrong with holding a sign and protesting. I fully support that.
yes,
That's a good thing. But I do want to know, so when that's over, like, what are we left with, and what's the
Yes.
action plan? And you do protests and rallies and marches to get somebody's attention. But once you got their attention, what is it we want? What is our ask? Right? There's got to be an end game. And I think figuring out the end game is something that should happen organically from the community.
Yes.
You know, back on your point of technology, the world was moving towards telehealth anyway. I know I can hit up my medical group on my phone 24/7 and hit up a clinician. And quite frankly, that's the way it should be. For not-for-profits, I think like LICADD and Long Island Reach, I think, you know, we don't have the capital to make those investments in technology. And so in some ways we've been hampered, and we also tend to serve populations that don't have the same technology at their disposal, particularly if we work in impoverished communities. But I would say for a good part of the population, access to treatment is easier now than it was 10 weeks ago because of that use of technology. And so our clinic visits in Hempstead and Hicksville, and now they're not limited to those communities, are up higher than they were in January and February by leaps and bounds. The same thing for our recovery groups as part of the Thrive Recovery Centers. We've had people jump on support groups from Europe to our Zoom initiating in Westbury. And so that's been really a gift. Now, I will say, and I think, you know, clinicians like Dr. Joe and Steve would agree, you do lose something via technology. You lose that face-to-face contact and that connection where you see things and hear things and pick up on things that you can't necessarily do in a Zoom call. But I will say, in an area that's transportation challenged, where the stigma of walking into a clinic or walking into a church basement for the same time is really daunting, the ability to say to somebody, look, log on to this Zoom call, you could be anonymous, shut off your video, and maybe spend 10 minutes, maybe hear something that resonates for you, maybe something speaks to you. If it doesn't, you click leave and you're gone. Nothing ventured, nothing gained. But I would say, for those folks that have a high level of acuity, whether it be a substance use disorder or a mental health issue, that's more of a struggle. So if you live in a home with 2 kids, it's a lot harder to carve out that time to go on a 12-step meeting via Zoom or to hit up a recovery coach. If you're a woman in a domestic violence situation, it's a lot harder to do that. And so there are pluses and minuses, but I would say overall, it's the wave of the future. It's where we're headed. And I think probably we settle into a hybrid model where some of these clinical services are made much more accessible virtually. And there's a hybrid model where maybe you hit up a recovery coach twice a week and go in once a week for a support group or a real-time clinical session. And I think that's where the world is moving. And so we were already headed there. Insurance was driving some of that, and just convenience was driving some of that. This was the last industry to be disrupted. I always talked about, so Amazon disrupted shopping and Uber disrupted transportation, and you know, there were other kind of factors and apps that disrupted hotels. Airbnb, you know, disrupted hotels. I was looking for something that was going to disrupt the behavioral health space, and now we've seen it. Ironically, COVID disrupted all of those other industries. So it goes to show you that all it takes is a natural disaster to disrupt everything. But I think now we have disrupted the behavioral health space, and this is an opportunity for us to advance telehealth in a way that's meaningful, not to replace face-to-faces with clinicians, because that's not a replacement, but it's important. And for that 17-year-old kid who says, I'm feeling a lot of anxiety, or I'm feeling down and I'm thinking about hurting myself, who wouldn't pick up a phone, God forbid, and talk to a person, maybe they FaceTime a clinician in a way that they wouldn't have before. And so maybe we wind up saving some lives out of all of this.
That's great. I love that. Thank you.
Any last thoughts from the speakers? Well, anything that you wanted to discuss, put out there, we can start that.
The technology too. I mean, listen, for parents out there, yes, it's a great way to communicate, and I'm not here to judge technology, good or bad. So, but like anything, there needs to be a balance with it. I think we're seeing a lot of young people, digital natives, who grew up not knowing what a phone attached to a wall was and all that kind of stuff, where we are seeing obsessions, digital obsessions, whether it's gaming, the purchase, or the use of drugs online, obviously pornography and some obsessions around that, skewed ideas about human intimacy and sexuality. So, there needs to be, like any great invention, some balance. So, but that has nothing to do with being able to reach out. I mean, listen, for people who are in self-help, they're able to go on for 60 minutes and get their medicine for self-help. That doesn't include travel time, because they're doing it from their own living room. And I think prior to COVID, a lot of us were struggling with time management because the world was moving so rapidly that this is a reset button. So I think it's all up to society and leaders in the community to really pick out the best of the best. But for parents and for young people, I mean, there is a downside to too much technology and not going to the great outdoors or the good outdoor direction. I was talking to a client the other day, and we were doing secure video, and he was all frazzled about something. And outside his window, I heard the birds chirping. I don't know. I said, "Are those birds?" He's like, "Yeah." And for a minute, it was able to redirect the conversation. Let's not lose sight of. There is a natural order to things, and on a sunny day like today, we don't want vibrant young people or older people, quite frankly, sitting in a basement playing 15 hours of gaming. They should be out interfacing with nature and safe distancing themselves right now. But there's something to be said about being outdoors and not living in a perpetual state of fear around viruses and etc. So I fear how people are going to view the great outdoors after this. There is a downside to technology with obsessions and compulsions. And listen, people spending a lot of money online with Amazon for stuff they don't need. It's actually a synthetic coping mechanism. I just want to fill that void. It's a type of self-medication, I would assume.
I'm in agreement. There needs to be some type of balance. I know as a pastor, the social distancing aspect has done a lot where people are used to touching one another, being in close proximity with one another, right? But also, when you talk about it from a mental health perspective, because this is what we're talking about today, I'm in agreement with Dr. Jeff, right? And so there are times when people don't want to have other people see them knocking on our doors. Can I get some time with the pastor one-on-one? Well, what is he going in there for? What is she going in there for? Again, there's a stigma attached. So they can use technology now to get to that mental health clinician, to that psychiatrist or psychologist, right? Or to get to the pastor and say, hey, I have an issue. Can I make an appointment with you? Yada, 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 yada. So there are pros and cons to it. Again, there needs to be some type of balance.
Dr. Joe?
Well, I basically, again, emphasize the balance. I think that's critically important. There's no question that utilization of telehealth resources is phenomenal in many respects, right? It's given us the opportunity, truthfully, to, maybe we've been disrupted by COVID, certainly we have, but I think we've been disrupted in our field less than in most other realms, right? We've been able to continue providing the level of services we were providing before. And to Jeff's point, I think that we too have experienced a higher level of utilization since the onset of the pandemic and the move to telehealth services. What I fear is that it can be viewed by some within government and certainly within the insurance industry as an opportunity to try to cheapen our commitment and the provision of resources, believing that somehow we can do it cheaper because now we don't necessarily have to invest in as much in bricks and mortars, for example. We don't need buildings. People can access services from their homes. We can expect clinicians to see more people, in quotes, see more people in a shorter period of time. So maybe we can get greater levels of utilization. And maybe in some cases that may even be true. But the fact of the matter is we can then get to the same place that we've gotten to in physical health services, where you have doctors who are not spending time getting to know their patients, getting to talk to them, getting to see how they're really doing, asking them how they're doing. They're busy writing the prescription before the person even walks in the door because of the expectations of the insurance industry, that their level of reimbursement is less than it used to be. And so now they have to have more patients and see more people in a shorter period of time in order to make the same amount of money or even less money than they were making previously. So there's a lot of potential here for abuse in all directions. So I'm concerned about that. I think that it comes back once again, though, to the question of what do we do as a community going forward, right? I would agree entirely that we have to build on the foundations that have been laid over these weeks, right? Whether it's the protests, whether it's the response to the pandemic, whether it's other things that we've been engaged in now that we've been forced into this state of isolation. The reality is that a lot of this can be an opportunity, something that we can build on going forward. And one of the things that we can do is what I think the protest movement, the greatest potential is that it can translate to votes, that we can let our elected officials know that we count and that they can't take things for granted, that things are going to be continuing the way that they once were. They're going to have to be responsive to those of us that stand up and speak out and make our voices heard, that we need to invest in human services, youth services, senior services, mental health services, chemical dependency services. And we need to make sure that the resources are redirected that can allow these systems to flourish rather than wither on the vine as they have been for a generation or more. We can redirect those resources from prisons where we incarcerate people instead of providing treatment opportunities. That we can redirect those resources from a criminal justice system that really is designed to perpetuate the status quo and the inequities that exist in our society. But that's only going to happen if we make our voices heard, if we continue to let our elected officials know that we expect them to do the right thing. If we don't, then we're missing an opportunity for tremendous change that I think is in the air right now.
If I may, if you all would imagine for a moment that one of the listeners tonight might be somebody that Dr. Jeff was describing, a listener who is struggling, maybe they're him or her as a teenager, and no way are they going to ask for help. No way are they going to come forward out of the shadows to reveal that they're suffering. What can be their takeaway tonight? What can be the takeaway for that person, that 16 or 17-year-old person who's drowning? What can be the takeaway tonight for them to have a better day? Anybody can jump in.
Yeah, so I'll start because I know you're trying to wrap by the 8 o'clock hour. Tell someone, find someone that you can confide in, and maybe it's one of us and our phone numbers are listed there.
Right.
Maybe it's the pastor at your own church. Maybe it's your rabbi. Maybe it's the kid that lives up the block. Maybe it's the longtime friend you connected with on social media. Tell someone, reach out for help. It doesn't necessarily mean you have to call a counseling center, although we always encourage that. But sharing the pain helps cut it in half. It helps break it into manageable parts. And so finding someone that you can go to, a parent, a coach, a teacher, a long lost friend, someone where you can just say, you know what, I'm having a hard time. That goes a long way. And I would say, and on the last webinar we included some free resources. Talkspace is offering some free services. Nassau County has an anonymous hotline, 516-227-TALK, that you can call anytime, day or night. You know what? If you don't like the conversation, you simply set down the phone. And so reach out and connect with another person. It's easier. In some ways, it's easier now than it's ever been before. And there's a whole bunch of people that are just ready, willing, and able to help you out. They had 17,000 social workers volunteer for the New York State Mental Health Hotline. 17,000 people.
Wow.
They're all in local communities, ready, willing, and able to help you without asking for a dime. Help is out there. Take the first step and ask for it.
Thank you so much, Dr. Jeff. That was awesome. Thank you.
I would add to that if you're the parent of that 17-year-old, and that 17-year-old may not ask anyone for help, but you see that there's some indicators of need, and you don't know exactly what to do, then you reach out. You give one of us a call, or give your pastor a call, or give your good neighbor a call, or ask someone, what can I do? Where can I go? How can I help my child in this case? And there are resources that can help you with that. Okay, so it's really both. To the youngster, reach out to somebody, let somebody know that you're hurting. And again, remember that all of us are hurting, and particularly during this period of time, that what we're going through is unnatural. What we're going through is not anything normal. There's nothing normal about this pandemic at all. And we're all experiencing a heightened level of anxiety, a heightened level of isolation, a heightened level of fear and apprehension. And so there's no shame. In fact, there's strength in being able to pick up the phone and talk to someone.
Right, right.
Yeah.
Thanks, Dr. Joe.
I would add, I would just support and stand behind everything that was just said. Speak about it. Tell someone that you feel comfortable talking with, coach, a friend. A lot of times young people don't even want to talk to their family members, right? So they have their friends that they do a lot of things with, that they're online with, gaming, things of that nature. Again, like Dr. Joe said, if you see something in that young person, not even that young person, that older person. I know many of people who were going through mental and emotional stress, and their wives or their husbands encouraged them to go to the hospital while they were sick, and then happened to say to the doctor or the nurse, listen, do you have a psychiatrist or someone, a psychologist on staff? I need to tell you something. And that's how the intervention happened. So there are different and multiple ways that you can get the person the help that they need, you know? That's all I would add.
Thank you, sir. Jeff?
Well, if no one else has anything to add, I want to thank the speakers for being on tonight, your professionalism, expertise, knowledge, and
enormous.
Generosity of your time is greatly appreciated. And
yes.
Most of all, I want to thank again the library, Jeff Zay, for operating the slides. Thank you so much. Keith Kling, as director of the Port Library, thank you so much. And I want to thank most of all the attendees here. If you liked what you heard, you can go onto the Port Washington Library YouTube channel and check out the recording, or you can talk to one of the folks that had their information on the screen, or you can reach out to Kathy and myself and we'll direct you accordingly. So I want to thank everyone for being here so much. we can all do this, you know, and so Kathy, do you have anything to say at this point?
No, I'm just really overwhelmed by the wisdom of this panel and the generosity to come here and to
Yeah.
speak in a way that everyone can understand. And so thank you very, very much.
You.
Thank you all. Okay, have a good night, a good week. Stay well, stay healthy, stay safe.
Be blessed.
God
Okay,
bless.
Thank you.
Be safe. Thanks,
bye
Jeff.
now. Okay,
Bye now.
Kathy, bye.
Bye, sir.
Bye-bye.
It's nice to meet you.
Yes, ma'am.
Thank you.
Everybody.
bye.
Nice work. Very nice.